Good morning, afternoon, or evening, depending on where you are at, and welcome to the WSAVA webinar Knowledge Drop. This one will be on how to use the WSAVA Dental Guidelines to improve your patient care and practice revenue. I'm Dr. Brook Niemiec, a board-certified veterinary dentist in both America and Europe, and I'm joined this morning, afternoon, evening by Dr. Kymberley McLeod, who is a resident in the College of Animal Welfare. Let me carry on, Kimberly. So we have to say, in all fairness, that I do speak for a lot of companies. I owned a lot of companies. Some of these companies that I speak for are sponsors of the guidelines as well. We will get to that slide towards the end of the lecture. But other than the ones that you can see, my training center, my practice, and stuff like that, I have no financial interest in any of these companies. I don't make money off of things if you buy them, other than dental air. If you buy an extraction kit or something from them, there's a little, like that much royalty that I get from that. Kimberly?
I do work for IDEX as a professional service or field veterinarian, though it has nothing to do with my work with the WSAVA Dental Guidelines from the welfare point of view of dental disease.
So most of the pictures from this book, or from this lecture, are contained in one of these books. So they are somewhat copyrighted. And really the main reason that I talk about the books is because, number one, some people want to take some of this home. And if you look at the bottom, there is my personal website, which is Dog Beach Vet, where all of the books, whether they were published by Wiley or CRC Press or myself, are all available there. But this Vet Perio book, which is what we're going to spend a lot of today talking about, or the Color Handbook, are both available online internationally. I'm pretty sure both of them are on Amazon. If you're international, you can pick them up there. But they're all copyrighted, so please try not to steal pictures from this and put it in there, because I don't even have copyright on them. Okay, take it away, Kimberly.
Well, one of the reasons that we're so lucky to be here is because of the World Small Animal Veterinary Association. And if you're joining us from around the world, hopefully you're familiar with what it is. But for any of our audience attendees who are not, the World Small Animal Veterinary Association is an association of associations. It is a grouping of veterinary associations from around the world whose mission statement is to advance the health and welfare of companion animals worldwide through an educated, committed, and collaborative global community of veterinary peers. My experiences with WSAVA have been incredible over the years, and I've had the opportunity to be involved with several different areas of both the Congress for continuing education, as well as serving, like I am currently, on the Global Dental Guidelines Committee. And people often ask me, I've heard about WSAVA, but how do you become a member? Well, again, a lot of the people that are on this call right now may already be members, not even realize it. If you are a member of your national association, the Association of Veterinarians in your area, you may well already be a member of WSAVA if that member association is a member. So for myself, I'm Canadian. I am part of the CVMA. The student chapter is the Student CVMA or SCVMA. Dr. Brook Niemiec is part of the AVMA, or the American Veterinary Medical Association. So again, he and I are both members of WSAVA because of our national memberships. And because of that, we're entitled to a wide variety of services and information, incredible online toolkits, free continuing education like we're hosting tonight, and also the advocacy of a strong, united voice that is WSAVA to advocate for veterinarians, veterinary needs, animal welfare needs around the world, and of course, to provide the kinds of services and outreach in countries that really do deserve them to get veterinary medical information to them. These guidelines came out of several conversations about how important it is that we address dental disease in animals. And oftentimes, veterinarians themselves even ask, why does it matter so much? Why are you and Dr. Niemiec so passionate about this? Well, we're passionate because this is by far the most common medical issue in small animal or companion animal medicine. We have review and peer-reviewed data, published data over and over that show that the majority of cats, over 70% of cats, 80% of dogs have some degree of disease by 2 years of age. We also have studies that say that even at this stage, perhaps even as many as 90% of dogs in North America in a certain study were found to have some kind of periodontal disease by 1 year old. Again, that's the vast majority. Add on top of that that in other studies, 10% of dogs that were noted in those studies had a fractured tooth with direct pulp exposure. So exposure of the nerve to the outside world. Up to 40% of cats, depending on what study you're looking at, feral cats as well as owned cats have tooth resorption. And again, the oral cavity is the fourth most common place to find cancer. When we combine all of these issues, the pain, the infection, this is a very common medical issue, and yet perhaps not one that's being addressed as commonly as you would think. We do know from published evidence that oral disease is painful. Animals are excellent models of oral pain in the human world. And in fact, laboratory animals, not just rodents, but also cats, dogs, other breeds, or other species, are often used in human dental pain research, where they're intentionally inflicted in pain, and then they use pain relief of a different wide variety to see what's most effective. However, unfortunately, a lot of our companion animals don't show signs that help us humans, their caretakers, understand the pain they're going through. And as we leave these conditions and don't address them head on and right away, lots of other local, so within the mouth and the face, as well as regional consequences can happen. Everything from eye infection, as infection trails up through the soft tissues of the face, fractures of the jaw, oronasal fistulas, so connection between an infected tooth root and the nasal cavity, abscesses that are deep and painful, and again, increased risk of cancer from this continued infection and inflammation. All are significant, and we know that these are happening in animals with unaddressed or poorly addressed dental disease. Even more frightening is the possibility of systemic consequences when oral disease is not addressed. The heart, the kidney, the liver, the lungs can all become infected by dental bacteria. Animals with uncontrolled periodontal and oral cavity disease have more difficulty controlling their diabetes than animals without. Arthritis is exacerbated in humans with very, very difficult arthritis and dental disease concurrently. In fact, there was a study that came out again in non-companion animals, in humans, but still in other mammalian species that showed that the risks of the comorbidity of having poor dental disease actually led to an earlier mortality risk than smoking. So again, we know that inflammation and infection left unfettered in the body is dangerous and can cause both local and systemic effects. But even more important to me is the fact that when we don't address these conditions because our animals don't complain, we are decreasing our patients' quality of life. Quantity of life, we just talked about, but let's talk about quality, the day-to-day ability for that animal to exist in a way that has positive outcomes. When quality of life starts to become impacted, we have to consider that even more significant than when the actual quantity of life is shortened. Adding them together, again, just shows us the importance of addressing these kinds of diseases early. The hardest thing for a lot of us as veterinarians, though, is how little education we get in this area that's so essential to veterinary medicine. I went to a Canadian veterinary medical school, excellent in the grand scheme of school rankings, very well thought of, incredible faculty, multiple professors that were publishing all over the world, research masters and PhD students coming in to study at this university. And we received 0 hours of dental education in my 4 years of veterinary school. And I didn't graduate that long ago. Now, thank goodness my school now has a board-certified veterinary dentist as faculty. But Dr. Candice Lowy is unique. She is the only boarded in Canada, and there are very few, even in America, that are faculty and teaching courses in the veterinary curriculum. As we extend around the globe, we know that even fewer of the universities globally have access to this kind of caliber of teacher. They may have some education, but again, in each situation, the curriculum is non-standardized. It's even harder to find continuing education, as many conferences don't even teach dental education as part of the streams. We're very proud that WSAVA has been such a leader over the last decade in increasing every year the hours of dental CE provided as part of their companion animal tracks at their global congress. So based on what I've just said, again, that dentistry issues or dental issues in our companion animals are so common that there's a lot of myths out there that we're going to try and dispel today about what we should or shouldn't be doing, what does or doesn't hurt our animals. That often we don't have the education we need to really do the right thing or even know what the right thing is. And there's a lot of ineffective procedures out there. And unfortunately, because of the lack of standardization and education, we'll talk about it today, but providing dental care to animals without adequate anesthesia has become very, very common in certain areas of the globe. And we will hope to show you today why that needs to stop for our patients' sake. And again, at the end of the day, we have a lot of confusion over what even causes infection, inflammation, and dental disease in a patient's mouth. And Dr. Niemiec is going to go into a lot more depth to help you understand that. But really, compared to even antibiotic use, vaccine use, all the other wonderful guidelines that have come out with the help of an organization like WSAVA, the reality is that the need for these dental guidelines was so strong because of the drastic differences around the globe in how dental disease was being approached by the veterinary community. So the committee itself was also quite novel. WSAVA has several of these guidelines committees. Please, if you have not gone on the website to look into the other guidelines that are available, everything, as I said, from nutrition through vaccines, through antibiotics, through anesthesia, pain control, welfare, which matters. We knew that dentistry was a very unique situation because dentistry involves a lot of different players and a lot of different veterinary techniques. So our committee comprised of dental diplomats or specialists from around the globe. In fact, from almost every continent. We also had a specialist who worked in a university in Europe, which was very important. As well, we had representation with a board-certified anesthesiologist, a boarded nutritionist who's also double-boarded in internal medicine, as well as two of us who work in the area of animal welfare, and specifically animal wellness and welfare as opposed to abuse, which is very important to distinguish. So again, why should you spend your valuable time with us this morning? Well, right now, it's more important than ever that we help our clients at the human-animal bond and keep it strong. We need to be efficacious veterinarians. We need to understand the disease processes that are happening. We need to help educate our clients, especially at a time of COVID when education is everything. And we have to provide the most efficient dental service we can because animals are being adopted at greater rates in every country every day as this pandemic continues. Each time we can provide better service, we get better outcomes for our patients, we increase our patients' own welfare, we help our clients see value, and overall, at the end of the day, we firm up and stabilize that human-animal bond that keeps companion animals in their homes with their loved ones where they belong. For myself, who received very little education in university, one of the first places I turned as I was working my way through this incredible document that's over 100 pages and free online was to the start. I wanted to just reestablish my knowledge of veterinary dental anatomy. The anatomy of the face, of the head of our animals is really important to understanding what we're going to do and how we're going to do it in each of our species. So you'll notice that in the guidelines, we have beautiful medical drawings that have been created specifically for the guidelines. If you wanted to, I know Brook talked about images in this lecture, but in the guidelines, we do have these images available for your own use too. You could go and teach at your local association or to a nursing college or to your own staff and use these or print them out for your own knowledge and use these beautiful images to grow and increase your understanding of basic orofacial anatomy. As well, there's a wonderful, again, complementary to you scoring system, a very logical and stepwise way to examine the oral cavity, make comments, and document changes that are important with each examination so that as that animal's medical record develops over time, you know where their dental health is and how much it's changed from the last time you saw them. It's also going to allow consistency amongst your staff members or consistency amongst veterinarians if there's change over time or the practice increases in its number of veterinarians that work there. And that standardization also allows you to speak to other veterinarians in the community with a common language around the world. At this point, I'm going to hand it over to Dr. Niemiec to talk more about the science of periodontal disease as a board-certified veterinary dentist.
Thanks, Kimberly. So one of the reasons that I really like talking about this particular disease, Kim's already touched on, and that's that most animals actually have it. And when you look at that bottom part right down there, right at this bottom here, I don't know if you see my pointer or not, but 70% of cats and 80% of dogs have some degree of gum disease by just 2. Here's the thing. Those are 1980s studies. We don't see the same population of animals that we saw in 1980, because in 1980, we saw dogs, right? I mean, we saw Labradors and we saw Shepherds and we saw Rottweilers and we saw all these big dogs. And what has happened over the last 30 years? We've bred them smaller and smaller and smaller and smaller. Small breed dogs get way more gum disease, and they get way worse local and, in my opinion, systemic effects from gum disease. And it's simply because they're smaller, so their teeth are crammed together. They have proportionally larger teeth, so that crams them even more, but they do have shorter roots, which makes them have severe gum disease earlier. And they're just more prone to these things from a hereditary standpoint. So current studies using periodontal diagnostic strip, using anesthetized patients as opposed to awake patients, have found that 90% of dogs at 1 year of age have some degree of gum disease. What does that mean? Essentially, every pet that comes into your practice every single day has gum disease. Oh, by the way, 30% of dogs under 10 pounds or 5 kilograms have bone loss already, not just a pocket, but actually bone that has receded at 1 year of age. So periodontal disease is not an old dog thing. It's a young dog thing. It's an every dog thing, and we need to treat it. Kimberly has introduced the systemic effects. I'm going to go a little bit further into that. I am a huge believer in the local and systemic effects of periodontal disease. Not every veterinary dentist is, but there's more and more studies that are coming out. I'm going to touch a little bit more on that. So, oh, Kimberly next. Sorry, I'm trying to advance it. Go ahead, next. Good job. So these are normal gingival tissues. They're coral pink in color. There's no plaque. There's no calculus. There's no redness. This is what you want your dog's mouth to look like. This is what I want your mouth to look like. The problem is, it took me 2 years to find this dog to put him in this lecture. Why? Because he just doesn't exist in nature. Because periodontal disease, by the time the dog is a year old, he's already started. I see these 9-month-old dogs with significant gingivitis already. So this is a rare animal, but this is what we as a practice or a group of practitioners need to look for. We need to start making our patients look like this. How do we do that? Prevention, 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 prevention. This is a normal dental radiograph. So you can see the bone fills up the area between the roots, called the furcation, comes right up to the neck of the tooth. Okay, this is normal. We see this more often than we see no inflammation, but we don't see this often enough either, especially in small breed dogs. Next. Okay, so here's the thing. This is one of the big things that everybody is taught and is wrong about gum disease. This is one of those myths that Kim talked about. Everyone talks about when you're diagnosing gum disease, flip the lip, look for tartar, flip the lip, look for tartar, flip the lip, look for tartar. No, tartar is ugly, but it's not the cause of disease. It is associated with gum disease. Sometimes you'll get dogs, most of the time, if they have a lot of tartar, then they also have concurrent gum disease, but not always. You can see animals that come in with the most clean looking mouths and have to extract half of them. Vice versa, you can have animals with bad calculus and have everything fine underneath. So what I want you all to do is to take away that, oh, look at the tartar, we need to be cleaned. And oh, by the way, we're going to talk about that with home care as well. Just because it removes tartar does not mean it helps gum disease. It's cosmetic only. So go ahead, Kimberly. All right. Case in point, this dog had a teeth cleaning about 6 months ago. You can see how beautifully clean the teeth are. There's a little bit of tartar on that upper first molar, but really clean teeth overall. But look at how much inflammation it has. The entire attached gingiva is horrifically inflamed. This dog desperately needs a cleaning. But if you'd have been looking for tartar, you wouldn't have said, oh, he needs a cleaning, he's fine, right? Vice versa, look at the other one. Look at this cat. He's got a huge iceberg of tartar running down his teeth. You physically could not put more tartar on this cat's tooth. Do you see any gingivitis? No. This cat desperately needs a cleaning, but if you clean that off, he's going to be fine. So tartar is not directly correlated to the amount of gum disease. So when you are determining whether an animal needs a cleaning, don't just look at tartar. Look at the level of inflammation. But oh, by the way, if you have a dark pigmented dog, you're not going to see that. So this is why veterinary dentists recommend cleaning every year. I mean, I ask this to every audience I go to. How do you decide when it's time to go to the dentist? You get up in the morning and go, well, you know, it's not loose yet. I'm okay. Or my boyfriend will still kiss me. You know, my breath isn't that bad. No, you go every 6 months, I hope. I mean, pre-COVID we did. Why? Prevention. That's why we brush our teeth every day. I hope 2-3 times a day, maybe. That's why we floss our teeth every day. I hope. Okay. And we go to the dentist. Why? Prevention, prevention, prevention. This has been the big thing. And I'm going to talk about this as a great little series that Kimberly and I have put together, actually on a plane in the middle of nowhere. But we need to do a better job with prevention, because when we talk about veterinary medicine or human dentistry, everything's prevention. You know, like I said, brush and floss our teeth, go to the dentist regularly. We do senior panels, we do senior exams, we do annual exams. Ladies, hopefully you get mammograms. Guys, we get our PSA checked. All of that's preventative medicine. Everything, human medicine, human dentistry, all that preventative medicine, except for veterinary dentistry, which is reactive. We wait for disease to be there and then we treat it. No, prevention, prevention. So this is a dog that has gingivitis. Okay. And so those blue arrows are pointing to that thin red line of gingivitis. Okay. This dog is infected. This dog is dying a little bit every day because of this gum disease. But the problem is the vast majority of us and all of our clients would go, but why do we need, well, not all, 99% of our clients would look at this dog and go, it's not that bad. Let's wait till February, National Pet Dental Health Month. We're having a special, right? Well, the problem is this dog's infected today. He needs care today. Because if you look at that and you see redness, swelling, bleeding, bad smell, what's that a sign of? That's infection. This dog's infected. And if you don't treat it, what's going to happen? It's going to get worse, right? So go on, Kimberly. Let's see the next slide. So now because we didn't treat that gingivitis, we allow it to proceed into periodontitis. And again, this takes an animal that actually is genetically prone to it. So now we've got some recession. Okay, we got a little bit of recession. If you take an x-ray, go ahead, Kimberly. Here's what it looks like. So you can see the bone's supposed to be kind of where those green arrows are. Now it's receded a little bit to where those blue arrows are. And the green arrows are actually pointing to tartar kind of trapped underneath the crowns. We can work with this. We can clean this up. It's going to take more than just a cleaning. So the client's going to have to pay a little bit more. You've lost its attachment. It's never coming back. Oh, by the way, periodontal disease is 100% preventable. It's 0% reversible. And if you don't treat it there, this is what we're going to end up with. I see this on a daily basis. This is my life as a veterinary dentist because we don't do a good job enough with those cases with gingivitis or those cases with early perio. Most of the time, we do this literally every day. Every day I see a patient like this. I'm sure you do too. Why? Because we don't do a good enough job educating our clients as to why we need to take care of it earlier. So this dog has been horrifically infected for years, and now he's got pus coming out, and all these teeth are wiggly. Go ahead to the x-ray. You can see where the bone's supposed to be, where the furcation comes together. Now it's down there. These teeth are all wiggly. We have to take them out. And your client's going to say, well, oh, Dr. Niemiec, well, it's so unfair. How is he going to eat? And I don't want to pay for the extraction, blah, blah. Well, the thing is, all this was preventable, 100%. And if you take these out, the dog's going to be a lot healthier. So that's why we have to treat it back at that gingivitis stage. Or actually, even better, don't let it get to the gingivitis standpoint. Treat it before. Use prevention, as we're going to talk about in a few minutes. So this is the example that Kim and I put together. We see that dog with gingivitis every day, and 90% of veterinarians would say, let's watch that. Or, it's not ready for a cleaning yet. And then what happens? You don't treat it, and then eventually you have to do an extraction, right? Well, compare it to this. This dog comes in, he was out at the park or at the beach, and he cut his paw pad. Is he dying from this? No. Might be limping a little bit, might be getting some blood on the client's carpet. They may not be very happy, but he's not dying from this. Would you look at this dog and go, you know what? March is our lacerated paw month. Why don't you come back then? Would you do that? No, you wouldn't. You would never do that, because you know if you don't treat it, it's going to get worse, right? It's going to get infected, and you might end up looking like this. Okay. So now we have to amputate these feet. Why? Because we didn't treat it before. And so the problem is, because we didn't treat it before, it got infected. Now, you have to do an amputation. Well, Dr. Niemiec, you can't think of an amputation like an extraction. The heck I can. What's a dog's hands? A dog's hands are his mouth, right? They only have one. They don't have two hands. They have one, okay? So if a dog's mouth is his hand, what are his fingers? His teeth. So when you extract a tooth, basically like amputating a finger. Think of it with that level of respect, and get your clients to think about it with that level of respect. And then they're going to be able to do it. So Kim's already touched on the next stuff. Okay, oronasal fistulas. Those happen because of chronic periodontal disease, usually on the inside of the upper canine. And a lot of times you can't see it. And you have to actually get the pet under to find the hole on the inside of that upper canine. But it can be any upper canine. And then once you extract it, sometimes it doesn't heal. And that's covered in the guidelines as well. We'll talk about extraction techniques as well a little bit later. But this is one of those things that's covered, how to fenestrate the periosteum and get it to close. If you're having problems with oronasal fistula, trying to find a course that you can take, I'm going to launch a virtual lab for people all over the world to be able to learn how to do these extractions and closures. Working on it next month. Hopefully we'll get there. But this is something that happens, and huge things, and mostly dachshunds. Dachshunds are by far and away the most common patient to get this. Go ahead on to the next one. Kim's already talked about this. Dogs lose their eye because of chronic infection. As a matter of fact, some of the ophthalmologists that I worked with came to this lecture, and they came up to me afterwards and we were so happy to hear you talk about the ocular problems coming with periodontal disease, because the vast majority of orbital problems that we see in dogs are dental related. Okay, carry on. This is a classic old dog that we, has never seen. It's a 4-pound poodle that has never had his teeth cleaned because the client's afraid of anesthesia. Kymberley will talk about that in a minute. But when we take an x-ray, this down here is 0.3 millimeters of bone. If you look at this dog's jaw wrong, it's going to break. It will. Okay. If you try and extract this tooth without dental x-ray, you're probably going to break the jaw. I would have, as a boarded specialist. There's no bone down there. So this is where dental x-rays, and we'll talk about this a little bit more in a minute, are critical. Oh, by the way, go back. Oh, by the way, where this tooth ends in relation to the bottom of the jaw is normal in a dog under 5 pounds. They have a millimeter normally. If this was a large breed dog, that would end halfway down the mandible. They'd have 2 centimeters of good solid bone below the root. You're never going to break the jaw. I tell people all the time, if you're going to take out the lower first molar of a dog over 20 pounds, don't worry about it. You're not going to break the jaw. But if you have to take out the lower first molar of a dog under 10 pounds or 5 kilograms, be afraid. And if you have to take out the lower first molar of a dog under 2 kilograms, be very afraid, because there's nothing there, even without periodontal disease. Then you add periodontal disease, you've got to be on the phone to this client. Actually, if you look at a dog, go back, Kim, real quick. If you see this dog in your exam room and it's a 4-pound dog, you should be talking to the client before you even admit him for surgery, that lower first molar is probably going to have to come out, and you could break the jaw. You could. It happens all the time. I see it all the time. So if you see this, you should be talking to the client. If you have someone to refer it to, I would refer it, honestly. Go ahead, Nick, Kim. I tell people all the time, if I had this dog or this dog, I'd refer him if I had the option, but I don't. I'm the specialist. I have to treat it. This is a pathologic fracture. The bone got weakened on that distal root. That's what the black arrows are pointed to. You have that dashed white arrow, which is the fracture, and then you can see the periapical rarefaction on the front root, the mesial root, which is the solid line. So this is what we want to try and avoid. And again, it's educating your small breed dog clients. Go ahead, Kim. So Kim touched briefly on this as well, but what I want to really hammer home in this particular part of this lecture is that the bacteremia from periodontal disease happens every day, not just with the dentistry. And so we all were taught, oh, you have to use antibiotics in a dog with a heart murmur because they're going to get valvular endocarditis, or you can't do anesthesia on a dog with a heart murmur because it's going to die and blah, blah, blah. Guess what? The bacteremia is happening every day that a dog has gum disease. And therefore, it's being spread throughout the body, affecting it. So there's no increase in risk of developing valvular endocarditis with doing a dentistry. But there is if you don't do a dentistry. So when you see these animals with comorbidities, take care of their teeth. It's going to make them healthier. And this is why and there's a whole bunch of information. If you want to go on the WSAVA Dental Guidelines, it's too much information for us to go over in this lecture. But we as veterinary dentists hardly ever use antibiotics anymore, like ever. I will use it one shot intraoperatively in patients with comorbidities, FELV, FIV, diabetes, kidney, liver, heart, murmurs. I will give one shot of ampicillin or tricarcillin or clindamycin IV or sub-Q, making sure you have blood levels during the procedure. But preoperative, personally, I don't. Postoperative, almost never. So antibiotics, please put them away. You don't need them. They're not innocuous drugs. You need to do something with them. Okay, carry on. So we talk about systemic effects, and I told you at the beginning when I started that I am a big believer in the systemic effects. Not every veterinary dentist is. I would say actually the committee was fairly divided, whether it is, so half and half, a little over half. That's why they're in there. But there are more and more studies on the veterinary side, lots of studies. I mean, I had hundreds upon hundreds, maybe thousands of studies on the human side that show a decrease in function of the kidney and the heart and liver, and increased inflammatory markers, diabetes, and Kim talked about the increase of early mortality. But here's the thing. Now there's animal studies too. And on the animal side, just so you guys know, kidney in dog and cat, liver in dog, heart in dog, and increased inflammatory markers in dogs. So all of these things are negatively affecting the entire body. So you do want to treat that. Next. But the flip side of that, and this is why I'm such a big believer in it, when you treat the gum disease, the heart, lung, liver, kidney get better. And again, the only thing on the veterinary side that's been shown yet, we're working on a renal study, but the only thing that's been shown so far in animals to improve post-dentistry is inflammatory markers. C-reactive protein and a couple other markers show that systemic inflammation does decrease when gum disease is taken care of. The other things, the kidney, heart, liver, diabetes, that's all human studies, but it makes sense to me. You don't have to believe it, but it makes sense to me that it is. And we see these patients being whole new animals right away. So what I'll tell people all the time, when an animal gets a little bit sick, don't stop treating the teeth. That way if they get really sick, you don't have to treat the teeth. Go ahead. So in the guidelines, there is step-by-step instructions on how to do a prophy with pictures. And so you can go in there, and it's like a free textbook, to be honest. And it's a minor textbook. I mean, it's not everything that you need, but it's a good basic. And one thing Kim didn't discuss, it's been translated into a lot of different languages. So it's really accessible to the world. Right? So what needs to go into it? Oh, actually, we're going to go and skip over to Kim now. Kim's going to talk about the anesthesia and preoperative workup and things like that.
As a general practitioner, I think it's really important that we are honest with each other, that for a lot of us, part of dentistry is the anesthesia and analgesia side. We know that access to anesthetic and analgesic products around the world varies. We've had the benefit of lecturing in many, many countries where the main source of questions is, what do I do with what I have? The guidelines are an incredible source of information because the anesthesiologist, Dr. Paulo Segal, who is part of this project, is originally himself from Brazil. He now is lecturing and teaching at the University of Montreal in Canada, but has also, again, worked all around the world with other international anesthesia and pain specialists as part of the anesthesia and pain guidelines that are part of the WSAVA Guidelines section or group. So the fantastic thing is that not only do the guidelines have very specific recommendations specifically for dental patients, not just for systemic anesthesia and analgesia, but for local as well, local within the mouth to relieve pain. But they cover everything from preoperative testing to maximize the knowledge of what state of health your patient is in and custom tailor your anesthesia to those patients. They cover fluid therapy. They cover drugs that help us to induce anesthesia, maintain anesthesia, how we should be monitoring our patients while they're under anesthesia, and different ways, as I said, to cover pain management, which is not an option in our animals. Dental disease hurts. When we are helping them and addressing therapeutically dental disease, that can be painful as well. These are all things that we need to understand. But again, there is also discussion of limited availability in certain countries. To augment that, there are also links to videos online to show you different techniques for oral anesthesia, as well as links to the more verbose anesthetic and pain guidelines that are available, because in those, again, it goes into much more detail what each of these drugs is for, how it works, and to help you to understand more about, as I say, continuing education to do with anesthesia and analgesia. The more comfortable that we as general practitioners get with anesthetizing our patients and providing great pain control, the smoother and more enjoyable these procedures are for both us and our patients. And the more comfortable, as we talk about and educate our clients, the more comfortable our clients are with what anesthesia is and what we're doing to make sure the risk is the lowest it can be. The risk of anesthesia is there. We are carefully titrating poisons technically into our animals' bodies with these medicines that allow that cognition to be depressed, to allow pain responses to be depressed without actually ending that animal's life. It's a very cautious thing that we have to do, and we don't take it lightly as a veterinary healthcare team. However, we do find globally the same questions come up, whether I was lecturing in Romania or in Canada or in South America. What do I do to help my clients not be so afraid of anesthesia? Well, one of the ways to help is to talk about the benefits and compare them to the risks, right? What is in it for their pet? What is the benefit of doing this? Amazingly enough, there are so many advantages to high quality oral care from the very beginning that if we stress the importance, as time goes on, the worry of the risks becomes lower. It's amazing what showing clients in real time, with videos or books, maybe of your own patients, bulletin boards in your hospital of before and after pictures. It can really, really help our clients. As well, knowing what anesthetic choices we should have will allow for custom tailored protocols. And again, when we're discussing with our clients what we do in our hospital that differentiates us from other hospitals, that's a great way to help our clients understand what we've done to improve patient care over time. Again, the most important two factors that I learned as being part of this guidelines committee was that if you can do nothing else to lower risks of anesthesia, keep your patients warm and keep your patients hydrated. Those are our two highest risks for patient mortality. It's not necessarily what drug you choose, inhalant versus injectable. Warmth, and warmth that's in a safe way. So in any way you can, and again, whether it's bear huggers, circulating warm water blankets, keeping the environment warm. I've even seen for very small breed dogs using bubble wrap around their paws to keep the loss of heat from paws and places we know, warming fluids. Monitoring, of course, as much and as often as possible. Too often in high quality hospitals around the world, I walk in and I see one person monitoring a long dental procedure. They might have two working on an animal who's having a spay or a neuter or something that, a laceration repair, one, working in a nursing capability to monitor and see how the animal's doing, the other in the surgical capability. But more often than not, with dentistry, there's a solo person trying to do it all and listen to everything. Wherever you can, we need to prioritize extra monitoring assistance to long procedures in older animals. And that's what most of our dental disease is: longer procedures, older or more compromised patients, often with comorbidities. What else can we do to help with patient care? Again, use of what we call multimodal pain relief. Now, that may be that you're using opiates or other central pain relievers to lower your dose of your inhalant or drip anesthetic. I see that the questions are coming in, so I will absolutely, I can't see them as they come, but we will address them. I appreciate all the questions you have. We do want to remember that for each country, knowing and understanding how these drugs work in each individual species, and also how they interact with other drugs those patients may be on, that's our job. It's essential, and we can't let that go by the wayside. In countries where non-steroidal anti-inflammatories are available and are licensed for use in companion animals, I am a massive fan. I know there is some concern about the use of non-steroidals in the face of extreme or very advanced renal disease. But again, if you are interested in knowing what's on the cutting edge of that research right now, the WSAVA Pain Group just put out an opinion piece in the Journal of Small Animal Practice that goes into all of the current state-of-the-art research that's out there, and with the help of a global committee of pain specialists, helps us as generals to understand what really are the risks and can we use these in renal patients. And I hope that you'll become more confident in what patients can have these. Pain relief isn't an option. Even patients with kidney disease need pain relief. One of the safest ways to give oral pain relief is what our dentists do: local anesthetics, right? With the use of lidocaine or bupivacaine injected into the nerves, or at least around the nerves of the mouth. Obviously, we don't want to ever inject into a nerve, but into the spaces, the canals that those nerves move through. If you've never seen local anesthetics given in a companion animal, within the guidelines, you can actually get a link to videos online on YouTube made by board-certified specialists to help you to learn this very simple, very inexpensive technique. I do work for IDEX. This is where I call out my side of things. So I will try to keep my language non-branded, because I'm a general practitioner and I worked for years in clinics that, again, I understood the value of preoperative diagnostic testing. And now I teach about it for a living because I believe in it so much. But the need to understand where our patients are today with their biochemical assays, with the evaluation of their internal organ functioning, is essential. Now, a lot of practitioners understand the need to take a look at the blood to see what's going on, to assess kidney function, liver function, immune function, hydration. But don't forget some of the finer points, especially with our older animals. The addition of thyroid testing, of urinalysis to understand hydration, protein losing situations in the kidneys, infection and inflammation, and how it's affecting the internal organs, very important. Dr. Niemiec is also a big believer, and he's actually often talks about how he'll do chest radiographs in some patients, but actually does an ECG preoperatively in all of his patients to better understand cardiac function before anesthesia is administered. We know that a lot of our patients are going to have comorbidities, whether they're young or old. And finally, before I turn this back over to Dr. Niemiec, we are really, really proud of the fact that these guidelines start at the beginning. I talked about how I went back and reviewed oral anatomy. It was a great review for me, even though I've been in practice for more years than I want to admit. However, a professional dental cleaning is something that all of us can get better at. It is the foundation of good oral health, and it's the foundation of therapeutic oral care. It includes a very specific set of steps, and if you skip any of them, we are not giving our patient the care that they could have and deserve. So you'll find the guidelines go through and explain very carefully your pre-surgical exam, how to do both under and above the gum line, or supra as well as subgingival scaling, how to remove calculus as well as plaque, how to polish the teeth afterwards to prevent the rougher edges that cleaning can sometimes create, and reduce the speed at which bacteria are able to recolonize those tooth surfaces. How to chart, meaning how to make a record of what you've seen for yourself or another veterinary healthcare team member in the future. It then goes into the importance of dental radiology, x-rays. Not just on teeth we think look damaged or we think are mobile, but on every tooth in the mouth. Because unfortunately, depending on what study you read, up to 40% of dental disease can be hidden to the human eye below the gum line, right? In where you can see the teeth surfaces, right? Unfortunately, subgingival disease below, up under the gum line where we can't see it, can make up to 40% of things be lost without x-rays. And again, how to discharge your patient back to their owner to talk very thoroughly with them about the findings and the therapeutic procedures you've had to do with their patient. The last thing I'm going to go through before I turn it over is a subject very near and dear to my heart. It is controversial. Not all veterinarians around the world agree on this, but it is in the firm belief of the group of 11 specialists and generalists who were on this panel from every continent around the world. It was unanimously agreed that the concept of non-anesthetic or sedation or, there's various words used around the world, but natural dentistry is one of them I've heard before. It has so many deleterious potential situations. And I think what really surprised Dr. Niemiec, as well as some of the other board certified dentists, is it wasn't even the dentists who are so passionate about it. It was those of us from other areas that didn't realize how prevalent it was and could easily see why this was not a practice that should be happening in this day and age internationally. Keeping in mind that there are many countries around the world who are saying, yeah, sure, if you want to, please, if you have time, spend some time reading the non-anesthetic dentistry section of the guidelines. It helps you to understand why this has a negative effect on our animals, how cosmetic changes to just the area of the teeth that we can see in an awake patient not only does the patient no good, but provides a false sense of security that things have been handled therapeutically when we know, as Dr. Niemiec pointed out, that cleaning the cosmetic part of the teeth without addressing subgingival disease is really deleterious to our patients. Again, the reasons that we feel this is unacceptable to continue. This addresses just cosmetic tartar. It's not effective for plaque removal that's ever been proven or published in a way that has been endorsed by the majority of veterinary dental specialists. Unfortunately, it can allow disease that's under the guideline, or gum line, which is painful, to continue and to fester while the visible symptoms are removed. We know, unfortunately, that our patients don't show us that they're in oral pain. So simply removing tartar, there's no proof that we've actually removed the infection or pain that was, it still may be continuing under the gum line. The other thing is how handling for this type of procedure affects our patients. There is an amazing study that came out of Germany that over 80% of the dogs that walk into a veterinary hospital are experiencing extraordinary levels of fear, anxiety, and stress simply by entering our clinics. That we would willingly then ramp up and do more procedures with them without addressing that fear, anxiety, and pain, potentially if we hit a painful area of the mouth, when we can. With good quality, safe anesthesia, we can remove that part of the procedure from our animals. The fact that we would choose not to goes against everything that the veterinary community stands for at first do no harm and improve patient welfare everywhere we can. Like I said, owners often think because things look clean on the surface that things under the gum line are fine, and we know they're not for these patients. We've seen over and over again in specialty clinics the negative side effects that can happen even though the teeth look beautiful. And right now we have little published benefit of any improvement compared to the risk benefit of very well done, high quality anesthesia. So again, the guidelines committee of 11 people from around the world who are both dentists, internal medicine specialists, pain and anesthesia specialists, animal welfare scientists, truly believe that non-anesthetic dentistry is a welfare concern for our patients, and it should not continue. Now, again, I understand that not every veterinarian around the world will agree with me, and I would always say that, I'm open to questions and such, but that was the feeling of the guidelines committee as a whole. The last part of my presentation, when it comes to my section of the guidelines I was involved with, I had the opportunity to also be involved with the guidelines and how they came together with home care. Home care specifically was written by an internal medicine specialist who's also a nutrition specialist, because so much of home care involves using nutritional products, but not all. And as a generalist, we can look at a wide variety of ways that home care can be provided. We do home care, hopefully, all of us on this call, every day. Hopefully we are brushing our teeth because the physical removal of plaque allows that plaque those bacteria to be taken off of the body, that biofilm to be removed. And when we physically remove it with the brushing of the toothbrush, that prevents that plaque from calcifying and turning into calculus. However, we do know that if we don't, 24 hours, we already have plaque. It's that fuzzy bunny slippers on your teeth in the morning. 3 days, so 72 hours later, that's already calcified into hard calculus. Now that gets harder to remove, and most of the time needs a sharp dental instrument. Within 2 weeks, even of the most amazing cleaning that an animal gets, within 2 weeks, gingivitis or infection with bacteria of the gums will start. And if we do nothing in an animal that actually did have pocketing or expansion of those periodontal pockets from infection, pockets return to the same depth they were before at 6 weeks if we do nothing. So cleanings are essential, but if we simply clean our animals' teeth once a year, that really turns into, of the 52 weeks in that year, the next 50 of them, your animal's back to having infection in their mouth if we do nothing but a cleaning. We have to do more. And unfortunately, we can't do anything. Unless this is your personal dog, they have to do something. So now it comes down to, what do you think your client can and will do? Two very important questions. Right? There's two things that you can do. Here's Dr. Niemiec with his dog Kaylee, the Labrador, and he's demonstrating in this picture how to brush teeth. A lot of dogs, if they are trained from day one, even if they're older dogs, will accept toothbrushing really well. A lot of very accepting dogs who have been handled on their face a lot will accept it at any point in their life. However, we know that, like so many other things that we have to teach our dogs to become desensitized to, and cats, having handling around the mouth, directly looking into a dog's eyes, can be considered very aggressive, very scary for them. And we do want to make sure that we're not encouraging fear biting or any kind of negative behavior that might break that human-animal bond. So this is a conversation we have on day one, the very first visit, whether that dog is 6 or 8 or 6 or 8 weeks. But the earlier we have this conversation, the better. Brushing, rinses during the day, these things are active. This requires a client who's willing to take the time and energy to do them. A lot of our clients right now are home. They're working from home. The pandemic has changed the timing that our clients have in their own home environments in some areas. So if that's possible, now might be a great time with all of our new, what we call COVID puppies, right? This COVID cohort, to encourage brushing and teaching each of your new puppy and kittens how to brush and rinse the oral cavity. Let's be honest though. How many of us on this phone call actively brush our dogs or cats' teeth every day? We're the ones who are supposed to know the most, and we often don't. I won't call Dr. Niemiec out and ask him how often he brushes Sage's teeth, but we do know that in a busy day, especially while a lot of us in the pandemic are busier than we've ever been, unfortunately, passive home care might be our only option. Passive is something you don't really have to do. It's kind of part of a dog or cat's day every day anyways, but there are things that have that added benefit of something you do every day with your pet, and they help with dental health. A lot of products are out there that say they will help. And some of them do. But actually, at the end of the day, the gold standard is always going to be brushing, and there is nothing else that can compare to good quality brushing daily. For our clients who either do brush and want to augment with passive home care or can't do something like a daily brush and rinse, passive home care is out there. It's possible. There are a lot of products available. However, I ask you to do your research. Please ask for published research that shows that the products you're stocking, A, work. And I don't care if they work for for tartar. Like Dr. Niemiec said, tartar is not the problem. We need an active plaque control claim. Proof that these products control plaque, and not just plaque anywhere on the teeth, plaque up and under the gum line. That's where disease is. No point just brushing the bottom of your teeth if you don't brush up to the gum line. You're not preventing disease in your teeth either, right? And these things have to be done consistently over a long time. So you may find that your clients are better with passive care, and that's great, but always remembering that passive and active ideally go together. Again, the other thing when it comes to passive care recommendations, please just look out for published studies. There is in some countries, there are labels that you can notice that might be doing some of that research checking for you. Again, whatever you do, make sure as a practitioner that you understand. The first thing I will say as somebody who actually works as a field veterinarian in industry, ask a lot of questions. Please do, because again, we know that all of these companies really want to sell their products, and that's great. We want to use them. We just want to be able to know that we're using the ones that work. The other recommendation I would give you from years in general practice, please don't bring products into your hospital that do more harm than good. Things that are too hard to be chewed on, smoked bones, hard plastic objects that are made for dogs to chew on, but actually fracture teeth. So again, there is research showing that things need to be soft and pliable. They have to have some give. There's a dentist out there that says if you wouldn't be willing to whack your own kneecap or your own funny bone with it, it's too hard. So critically look at what you've been bringing into your hospital as options or what you recommend, and make sure you're not creating situations as well. Speaking of which.
Okay, so now let's jump into fractured teeth, which is the next most common problem we see in pets. There's a study from the 80s, which again, large breed dogs, so I don't know if it's quite as common now. 10% of dogs have a broken tooth in their mouth with direct pulp exposure. You guys see 10 dogs in your practice on an average day, I'm betting. One of them has a broken tooth with direct pulp exposure. These are painful and they need to be treated. We hear all the time, still today in California, USA, we still hear, oh, let's watch that. Let's wait until it abscesses. It does bother the dog, and it absolutely needs to be treated. Go ahead and let's show them the picture, Kimberly. This is what we call a complicated crown fracture. Okay, and again, 10% of your dogs have that. You can see the living nerve poking out of this. This dog is in horrific pain. So what I tell people all the time, every tooth with direct pulp exposure is either horrifically painful, incredibly infected, or both. And there's only two options for therapy, and that's root canal therapy or extraction. Okay, and in most of the places of the world, extraction is certainly acceptable. If you have an enthusiast or a dentist in your area, saving strategic teeth is important. I think most of us, not all, know that complicated crown fractures, direct pulp exposure needs to be treated. But what most of us don't know is that uncomplicated crown fractures need to be treated as well. And like Kimberly says, it's not just that there's no complications. It just means that the root canal is not directly exposed. However, uncomplicated crown fractures are incredibly common. A study by, I think it was University of Wisconsin, over 50% of animals have uncomplicated crown fractures or something that exposes the dentin. Let's take a look at it. This is a classic uncomplicated crown fracture of an upper fourth premolar. How often do we see this? Every day, right? Every big dumb dog chews on something too hard and breaks their teeth. So that shiny area is the enamel. What you can see, that kind of dark stained area at the tip, is dentin. Dentin is a living structure. It has microscopic dental tubules running out, millions of them, up to 100,000 per square millimeter. So that right there is about 500,000 dental tubules exposed. Each one contains a nerve. So these animals are painful and it needs to be treated. How do you treat uncomplicated crown fractures? Well, there's two options. It's either, it depends on whether there is radiographic evidence of infection. And I just had a study published, I guess it was just last month, which finally got through. About 20% of these fractured teeth have infection, and you never would know it without x-rays. So speaking of x-rays, go ahead, Kymberley. In the dental guidelines, there are step-by-step instructions on how to take dental x-rays in dogs and cats with high quality video or photos that show you how to take each one, and also a little bit on how to interpret it. So going back to the uncomplicated crown fractures, going to the next one, Kim. Okay. Oh, Kim talked about this already. There we go. So keep going. Just go forward. There should be another picture of that. Go forward. One more. There you go. So here we are. So here's the x-ray of that tooth. Okay. And what you can see is there's no periapical lucencies. Okay. So there's no big black holes at the tip. The root canals are appropriate in size to the tooth behind it. So this tooth is alive. Go back, Kim. So when you see this tooth and you get that x-ray, what we recommend is a bonded sealant. It's dirt cheap to get into, well, at least on American standards. Very inexpensive to get into, about $600 if you have x-ray and a drill system. And if you don't, we need to talk about it. But this is the dog's opposite side. And you can see the fracture looks very similar. But when you take an x-ray, there's your periapical lucencies. This tooth is dead and infected. According to the study, it's about 20% of these. So when you see these chip fractured teeth, that means you absolutely have to take dental x-rays. And if the x-rays are normal, again, a bonded sealant. If you see this, root canal therapy or extraction. That's why I really like people taking dental x-rays to do bonded sealants, because they find these. Carry on with him. Speaking of extraction, we hate to pull teeth. I tell people, like I said before, it's like amputating a finger, okay? So while it's extreme, it is the cure for periodontal disease. And I hate pulling teeth. And the one on the left, that deep pocket, we could do guided tissue regeneration on it. But the one on the right, you can see that how bad the bone is. But again, you need to be really, really, really careful when you extract these teeth, because again, you could break the jaw, especially in dachshunds. And since, go ahead, Kim. So there is, on the dental guidelines, we have step-by-step. And again, it's not a full, textbook, but it's definitely a lot of information on how to do extractions, making flaps, all that kind of stuff. So take a look at the guidelines. I'm going to answer these questions because I've got an emergency that I'm going to need to go deal with, and I'm going to let Kim finish this up because that's where she takes over. But before I go, and I will be happy to take any questions that you guys have, Kim can just text them to me and we can answer them. But Kamara, doctor, I'm sure that was mangled. Should we extract furcation teeth even if there's only 10 to 15% bone loss? Yes. On the human side, if you can get furcation 2, which is halfway through, or furcation 3, which is all the way through, you can't clean that tooth without direct root visualization. So if you can get that probe halfway or all the way through, unless you know how to do periodontal flap surgery or the client's willing to be referred for periodontal flap surgery, the dog's better off without the tooth. Yeah. And I hear that as a question all the time. It's like, well, it's not 50% bone loss. I don't care. You can't get rid of that infection without extracting the tooth. Okay. So yes, I'm pretty aggressive when it comes to extractions. And again, I'm a dentist. I like saving teeth. That's my job. But as a physician, I want your babe free of pain and infection. And if the only way I can do that is to extract the tooth, that's what I want to do. As far as can periodontal disease lead to nerve problems? Yeah, that's a good question. I don't know. I wouldn't say it's common to have nerve problems or neurologic problems. There have been some studies that look, or case reports, I would say, that look at neurologic things with brain abscesses and stuff. I don't know if that's, really a cause and effect. What I would say is the bigger thing from a nerve problem issue would be when you get those infected lower first molars, if you go back to those x-rays and look at them, those nerves or those roots end in the mandibular canal. And the roots ending in the mandibular canal, they really have inflammation around those nerves. So I would say that there is some neurologic pain from that. But I would say as far as a cause ratio of that, I'd say probably not. So take it away, Kim. You can finish this up and talk about the welfare side. I mean, who cares about welfare, right? Kim will talk about that and kind of bring this home.
Dr. Niemiec, just before you go, can you just clarify as well about the within the tooth, right, in the pulp cavity of the nerve? Because I know there are, in the guidelines, there is mention of, again, how periodontal disease can actually track through a tooth from one side through the tooth and then come down the other side of that root canal. So perhaps just to clarify, in case the question had to do with the nerve within the tooth, so to speak.
Oh, yeah, good point, Kimberly. So when we talk about that, what she's describing is what's called a class 2 periodontal endodontic abscess. And that's where you get the infection running all the way down one of the roots of a multi-rooted tooth. It's typically the distal root of the lower first molar. Those are the ones that will typically get infected, but it can be any multi-rooted tooth. And you'll get infection through what used to be the blood supply, and that will kill the tooth. And then the bacteria will spread through the common pulp chamber up in the top of the tooth in the crown, and then create periapical infection on the other roots. So it's very similar to those complicated crown fractures where they get infected and it just drains out the other thing. And again, if you're seeing that, we can do what's called a hemisection root canal, but honestly, it's best just to take them out because that way it's cured. Okay.
Thanks, Dr. Niemiec.
Thanks, Kimberly.
You're welcome. So we're in the final stretch now. Thank you all for taking your time with Dr. Niemiec and I during this pandemic. We do appreciate it. Again, from going back and forth from the benefits of this kind of a guideline written for free use into multi-languages around the world, one of the other places that we've received the best feedback has been the fact that there is an entire 10-page or so section on what the different dental instruments are, what they're for, how to use them, and what every practice, whether you are in Central Africa, South America, North America, Europe, what every practice needs at its fundamental, most basics to provide good quality dental care, and how to then work up to the gold standard that perhaps a specialist in a country might have. All of these are discussed using the 3-tiered format for the different countries in the world based on the WSAVA CE committee system, which helps to rank different countries based on, of course, their socioeconomic and educational level in that country. And hopefully that'll help you to increase the standard of the veterinary dental care you're providing by helping you choose how to spend the funding that you have in your hospital on either new equipment or updating equipment that you already have, but want to look at, updating into a different situation. There we go. One thing that Dr. Niemiec always speaks on, and again was a learning curve for a lot of veterinarians around the world, for our veterinarians that have a high-speed sectioning unit. So the ability to use a turbine to drive a drill, and that drill being able to split the tooth or cut the tooth or take away bone in very small sections, like again, a human dentist likely would have. Please keep in mind that the burrs, the actual cutting surface of those drills, those drill bits, so to speak, are disposable. They are meant to be used once for only one patient, and oftentimes multiple are needed within the same procedure. If you're having to section multiple teeth, so cutting through teeth and cutting through bone immediately dulls the burr, and as the burr gets dull, it can't work as hard, and that's actually going to break your high-speed unit. So for those of you who work in hospitals where you're reusing burrs multiple times, or you might have a good burr and an okay burr box, do what you can to advocate for that to change. Those burrs are far less expensive than the high-speed unit. And again, every time we're overheating a burr because it's dull, we're actually overheating the tooth and the bone around it, and we're burning our patients. So again, where we can, those burrs should be brand new every time. It's hard for us, I know globally everything's different, but on a North American standard, they're about the equivalent cost of a quarter cup of coffee. So hopefully this is something that we can invest in. Same thing if you have an ultrasonic scaler to remove plaque and calculus off the teeth surface. These little jackhammers, the surface of that jackhammer that's hitting the tooth every time like this will decrease. And as soon as you lose even a few millimeters on the length of that tip, you decrease the efficiency of cleaning. And again, you don't have as much of an ability to be fast and efficient and safe under anesthesia for your patient. At the crux of these guidelines, for each of the people, each of the specialists that was involved, those of us who are generals that were involved with these guidelines, it came down to what is in it for the patient in front of me who's come into my veterinary hospital. Why am I advocating? This is a hard conversation. My client doesn't want to hear it. They don't want to spend the money. They don't think anything's wrong. We have references to explain that dental pain is truly real in our patients. I mean, animal species are excellent sources of dental pain in people, excruciating, chronic dental pain. And unfortunately, we know that if we undertreat or don't treat at all these dental issues, that pain continues and the infection builds and the drain on the system is significant and systemic. Interestingly enough, there are studies coming out to show that properly addressed dental disease can, again, allow diabetes to become better controlled, can either maintain or even reverse the damage done to kidneys and increase the glomerular filtration rate of those animals. There are behavior changes that happen quite often. While the client may not have seen their patient becoming more and more debilitated, how many times do I hear from my veterinary peers around the world, I love dentistry. It's hard, but every time I do a good job, I get a client who comes back in a week or two going, oh my gosh, you gave me my puppy back. She's herself again. She's running around the house. She's kissing people. She doesn't get bitey when I touch her face, right? We've removed pain and infection, and their bodies take this big, deep breath and go, oh, that feels so much better. That's why I went to veterinary school. That's what I wanted to do for a living. I just wanted to make tomorrow better for my patients than it is today. And there's honestly nothing more rewarding than doing great quality dental care for doing that. Other things we've talked about, again, remembering these animals deserve humane handling techniques. They're in pain. They're infected. Their arthritis might be worse. They might be more sore and achy. Be gentle. Be kind. They're not bad dogs or cats. They're scared dogs and cats. They're painful dogs and cats. So remembering that before, during, and after, try and keep your hospitals as quiet, as patient, as humane, and as empathetic as possible. These guys don't want to be reactive. They just don't have a choice. And again, placating the need for our customers or our clients to put pressure on us as veterinarians to not do the right thing with anesthesia and try to provide these services without because they think it's in their patient's best interest. Please no, it's not. In many, many countries around the world, and every board-certified veterinary dental association of dental specialists have banded together to say, this isn't a good idea. It might seem like it is. You might even be able to think of reasons that it is, but we've seen over and over again, it's not. It's not. And hopefully over time, we'll be able to move forward. Safe anesthesia, safe pain control, safe anxiety relief is always the right choice for our patients. So again, based on all of what you've heard today, WSAVA does truly believe as an organization that undertreated dental disease is a significant animal welfare concern. You're doing the right thing when you advocate for your patients to get them the care they need. A lot of my veterinary peers are wondering at a time like this, during a pandemic, when a lot of us were forced and are still forced to see fewer patients per day with much more difficult, maybe curbside care or more intense cleaning protocols. Everything's less efficient. We're all exhausted right now. And on top of it, a good number of us lost a lot of practice revenue, and our hospitals are struggling to make that back up. There is nothing that's more ethical to increase your practice revenue than by treating pets who have disease and making them feel better. And the joy of it is this is revenue that can't be purchased elsewhere. You can't order dental care online, not effective dental care, right? Cleanings and extractions are still something that's very firmly based within the veterinary hospital. So again, just the fact that the pandemic and other reasons have changed our revenue streams this year gives us all the better reason to feel good about doing dentistry. If we get more efficient with good quality equipment like the guidelines will help you to choose, with faster and more efficient procedures by investing in training, actually reading the sections on the procedures, how to handle the instruments, how to make sure your instruments are at their most effective so you can be fast, increasing your preoperative testing to make sure your patients are safe, and doing better postoperative care, it's amazing how each of these things does slowly expand the investment that a pet owner is making in their pet for good reason. All of these things are very ethical streams of revenue, and they're wonderful ways that also keep our pets safer, healthier, and happier. So you'll see in the sections that talk about minimum standards, x-rays, how to choose things, allow you to do a really good job. And by doing well, you're doing good, right? The other thing is that there's lots of great education and training for your staff members. If you've listened to this today, feel free afterwards. This is going to become a live stream that you can have access to again. If you have staff members, peers, colleagues, other people in the hospital who should hear this message, they might be going, oh, well, I know Dr. So-and-so recommended it, but I don't know, he's probably fine, he's still eating. Yeah, I had 9 root canals and excruciating dental pain through all of them because I have a genetic predisposition to pulpitis. I didn't lose a pound. I ate through that pain. I couldn't sleep through it. I had difficulty working through it. But I didn't lose weight. I ate anyways, because if you don't eat, you die. If you don't sleep, you just get really, really grumpy. Okay? So again, if you have staff or peers that need to hear this message, let's continue to get it out there. The more that we understand it, the better that our communication techniques get in explaining it and educating our clients from the very first day they set foot in our hospital, the easier every day gets for us as a veterinary community when it comes to dental health for our patients. And WSAVA is developing a toolkit for you guys. Now that we have the guidelines published in the Journal of Small Animal Practice, both in a short form, which is published in their actual paper journal, as well as the fully verbose guidelines that are online for you that go pages and pages into each of these topics. We're also going to be bringing up over the next 2 or 3 years the kinds of in-person client-facing or veterinary-based tools that will help you do your job faster and easier. And they'll be translated, like the guidelines have been, into multiple languages. They're always going to be free for WSAVA members. There's no commercial branding on them from any company. They're just there for your help. There are lots of other websites online that you can go for help. Dr. Niemiec has dogbeachdentistry.com. On that are also free, non-trademarked videos that explain dental requirements in English. And I have had peers around the world who've chosen to download that, and then they've just voiced it over themselves in their own language. So again, feel free to access that information. Lots of posters and books that are out there. You can create them yourself, but things that help to show why we're doing what we're doing and how it makes a difference in our pets' lives. So in conclusion, the fact is that, like Dr. Niemiec said, almost every patient who walks into your hospital today, tomorrow, next week, is going to have something they need help with. They just don't know how to tell us. Whether it's periodontal disease, a fracture, tooth resorption, a dead tooth, a tumor, stomatitis. These things need to be addressed for our patients. And hopefully the dental guidelines will help you increase your knowledge, your skill, your efficiency, something that will end up benefiting your patient, right? The shorter the anesthesia is, the less traumatic it is, the better the care these patients get, the better the patients do at home. The more we increase their quantity of life, but most importantly, the more we increase their quality of life. Clients benefit from that. Veterinarians benefit from that. Our staff loves hearing those stories. These are the things that keep us going in difficult times. And I think everyone on this call can agree, in most of our lifetimes, this is the most difficult times we've ever had to face. We need these positive stories to keep us going. So talk about them as well amongst yourselves. Share when dentistry is working. We need that positivity in our environments. So I'm going to challenge you over the next days, weeks, months. Think of periodontal disease the way you think of any disease in the body, not as something to be dealt with when it gets bad enough, but as something to be dealt with head on from the beginning. Prevention and education from day one. Treatment, not when it gets bad enough, but from the first time we acknowledge there's any kind of therapy that would benefit the pet. And continuing, even in the face of being told no the first time from a client, continuing to advocate, continuing to educate, because we need our customers or our clients to understand that their health, their quantity of life, and their quality of life all depend and start and finish in a healthy mouth. Every one of our patients has the right to a pain and infection-free oral cavity. Now that's what we should be striving for. I did notice, I'm at this point, I'm done. We thank our sponsors so much. I did notice that one other question came through. Let me pull that up. Okay, thank you. Just a comment that we didn't have any other questions. So thank you all so much for taking your time with the two of us today. I hope you've taken home something new today that you can utilize in your hospital. Again, get online, the Journal of Small Animal Practice, as well as the WSAVA website. Both host the dental guidelines in its full format, always free. And we're so proud that we were able to volunteer for this project, the 11 of us, and contribute back to our peer community around the world.